Hi, welcome to this video session. Let me introduce you to the concept of purposeful hourly rounding. This means we round on every inpatient every hour with a purpose. Hi everyone, glad to see you all. In acute care inpatient areas, depending on the patient population, doing a purposeful hourly rounding on every patient is found to be very effective for patient safety. It is expected to be done hourly during daytime from 6 a.m. to 10 p.m. and after that every 2 hours during nighttime. Purposeful hourly rounding are proactive rounds we make to meet all the needs of the patients and also to maintain patient safety. In addition, hourly rounding also has many other advantages. Can anyone name some of the advantages in doing hourly rounding?
It will decrease call lights or patient calls.
Yes, very good, Brian. Yes, if we go in proactively and meet all their needs so that they should not have any reason to call.
I have a question. What all are we supposed to do when we do the hourly rounding?
That is a great question, Kendra. Hourly rounding consists of 4 main elements. Number 1, use the acronym CLEAR. Number 2, checking 5 Ps. Number 3, environmental safety checks. And Number 4, using keywords. Let's look into these one by one. Number 1, use CLEAR. CLEAR is a relationship skills and also a framework for communication with the patients. Always use CLEAR during any encounter with the patients. CLEAR stands for connect, listen, explain, assure, and respond. C for connect. Connect with the patient, eye contact, greet them, acknowledge them by name, introduce yourself. L for listening to the patient's questions and concerns. The letter E for explain what you will be doing and why. The letter A for assure the patient about the care and what to expect, and the R for respond, address all identified needs of the patient and family. Upon entering the patient room, first, knock at the door. Then, use hand sanitizer and rub your hands until dry. Here is an example of using CLEAR.
Hi, Mr. Smith. My name is Gina and I'm your nurse today from 7 a.m. to 7 p.m. I see you have a visitor. Hi, Mrs. Smith. I'm here to do a purposeful rounding and that will take about 5 to 10 minutes. We will be doing purposeful rounding every hour during daytime and every 2 hours during night. During these hourly rounding, I will be checking to see if you have any need or anything I can help you with. Let me update the communication board.
This is how to use CLEAR. Second element in hourly rounding is checking for 5 Ps. 5 Ps are: Number 1 P is pain. Ask the patient to rate the pain on the scale of 0 to 10. Ask them what can you do to make them more comfortable. Next P is personal needs. Check whether they have to use the restroom. Assist them as needed. Number 3 P is positioning. What position they need to be on, or remind to change their position every 2 hours. Next P is personal belongings. Make sure all the personal belongings are at reachable place. And number 5 P is check the IV pump and IV site. Make sure there is no issues with these. The third element in hourly rounding is do environmental safety checks. Check the patient's environment for any safety issues. Keep it clean, safe, and clutter-free. Number 4, use the keywords. Does anyone know what are the keywords?
I think the keywords are listed in the parentheses in this handout under the Connect section. They are safety, privacy, clean, informed, etc.
Thank you, Joanna. Great job for listing the keywords.
Why are these words called keywords?
Keywords are the words used in the HCAHPS survey questions that patients get in the mail after discharge. So, we need to use these keywords in all our conversations with the patient and family. After completing the purposeful hourly rounding, upon leaving the patient room, remove the gloves, close the door for privacy, and then do hand hygiene according to the policy and guidelines. Doing good, consistent, purposeful hourly rounding leads to happy patients, and better patient outcomes. Other benefits of doing purposeful hourly rounding are patient safety, decreases falls, helps in early identification of patient deterioration, reduce patient and family complaints, better pain management,
reduces call light usage, work efficiency or better planning of daily tasks, and, eventually it will also, increase patient satisfaction in the HCAHPS score.
In contrast, inconsistent and poor hourly rounding may lead to bad outcomes such as patient falls, angry patients, and many other patient safety problems.
This concludes the video on purposeful hourly rounding. Wish you all happy rounding.